Hi everyone, my name is Monique Perez and I'm presenting as a budget analyst from St. Rose Hospital on why we should adopt Lean Six Sigma management techniques. Here at St. Rose, we offer a wide variety of services including orthopedics, heart and vascular care, neurological care, weight loss surgery, emergency services, and birth center services. So far this year, we have a total patient operating revenue of $365,391,110. By this number, you can see that we serve a large population of patients, which means there are more chances for errors. We believe that you, your health, safety, and patient experience should be our entire focus. From the moment you walk through our doors, caring for you is our number one priority. And every hospital seems to have the same issues with adverse events that could be prevented by taking necessary precautions. Adverse hospital events can show up in many ways, such as catheter-associated urinary tract infections, bloodstream infections, surgical site infections, pressure ulcers, surgical errors, blood incompatibility, ventilator-acquired pneumonia, patient falls, and medication errors. As a budget analyst here at St. Rose, I think that it is very important to adopt Lean Six Sigma techniques in our hospital to help eliminate defects throughout our organization by preventing medical errors, reducing lengths of stay, decreasing mortality rates, and improving the care and quality for the patient. Using Six Sigma decreases variation, process outcomes become more predictable and effective. Lean targets the efficiency of processes, decreasing waste and increasing profitability. When the two parts come together, they produce a synergistic effect financially and in terms of patient and employee satisfaction. Lean Six Sigma follows 5 steps to improve processes in the hospital. To function effectively, you need participation from all members of your organization. The first step is defining the problem that you're having. To do this, you need to know who your patients are and identify what they need. The next step is measuring. This means assessing the current process and defining how you are going to measure your improvement. Metrics used to define performance in a healthcare organization often include service level, service cost, patient satisfaction, and clinical excellence. Next, you need to analyze the cause of the issues. Examine the process and data that was collected, display the data, and investigate and confirm what's causing the issues, and then continue updating the project charter as needed. After analyzing the issues, it's time to figure out how to improve the process. You can take all of the data that you've analyzed and piece together a solution with perfectly laid out steps. Taking steps to implement the new fixes will help it be successful, and you should always continue to measure your improvements. Lastly, and most important, is control. You need to continuously monitor how efficient your processes are and be able to maintain these improvements. In order to implement a Lean Six Sigma management technique into our hospital here at St. Rose, we need to create a Six Sigma infrastructure by providing training that has a process-oriented approach that teaches your employees a methodology that allows them to select the right tool at the right time. To train our practitioners to be black belts, using this approach will consist of 4 weeks of training over the span of 4 months. By choosing specific projects to our organization, we are deploying Six Sigma as a business strategy and will be able to benefit from it from the time and money that is invested in the Six Sigma training. We need to consider all of the benefits that will come from deploying specific projects that have executive management support. These include offering a bigger impact through projects that are tied to bottom line results, utilizing tools in a more focused and productive way, providing a process for project management that can be studied and improved, and also increasing communications between management practitioners via project presentations. Adopting Lean Six Sigma techniques into our hospital is a long-term commitment, and we will need every member of our organization to get on board. By creating Six Sigma projects, we will increase our organization efficiency, improve customer satisfaction, reduce costs, increase revenues, and much more. Here are the references that I used to create my presentation. Thank you for listening. More benefits include facilitating the detailed understanding of critical business processes, giving employees and management views of how statistical tools can be of significant value to the organization, allowing black belts to receive feedback on their project approach during training, and also by deploying Six Sigma with the closed loop approach, it creates time for auditing and incorporating lessons learned into an overall business strategy.